Last week we talked about food insecurity. This week we'll focus on what we can do about it through food support programs. We'll also talk about how such programs affect health outcomes. This is the second half of our two-part series focusing on the effects of food insecurity and food support programs on nutrition and health, which we're bringing to you with the support of the Robert Wood Johnson Foundation. Food support programs are the topic of this week's Healthcare Triage. Food insecurity has many potential negative health effects for people who can't get enough to eat, including more than 12 million children. This week we're focusing on food assistance programs and how they affect food insecurity and overall health. The first is the Supplemental Nutrition Assistance Program, or SNAP, which is the program people are talking about when they talk about food stamps. SNAP provides electronic vouchers for the purchase of grocery store foods. SNAP benefits are income-based and provide assistance to an estimated 1 in 5 households with a child between the ages of 0 and 4. States can set their own rules about how poor families need to be to qualify for benefits. SNAP has a national median benefit of $12.86 per day, or $386 per month. Families who make less than half of the federal poverty level receive about $17.40 per day. Average national SNAP benefits are about 27% shy of the average cost of a meal. That may not sound like a huge amount of money to some, but it can make a huge difference in people's lives. In addition to these benefits, all children of households receiving SNAP must be certified for free or reduced cost school meals. The Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC, is the other big safety net program combating food insecurity, and it provides benefits for pregnant women and children up to the age of 5. These include vouchers for specific food items such as infant formula, eggs, and milk, as well as nutrition education and referrals for healthcare and social services. The percentage of infants in the United States participating in WIC is just under 50%. Let me repeat that. About half of the babies born in the United States participate in WIC at birth, and that number declines to 14.2% by 4 years of age. Benefits are need-based and do not taper off as households earn more. In recent years, both of these programs have come under fire. Some believe they are unnecessary, or at least that more people are using them than really need them. To debunk some of the myths surrounding SNAP benefits and the recipients, the Robert Wood Johnson Foundation has developed a series of videos featuring the stories of families receiving SNAP. We've included a link to those videos in the description. Similar to those stories, much of the research has a different story to tell as well. Beyond directly reducing food insecurity by giving people food or the ability to buy food, data tell us that WIC increases and improves nutritional intake in pregnant women, increasing intake of nutrients like protein, vitamin C, iron, and calcium. WIC is also likely to decrease birth-related Medicaid costs, and both WIC and SNAP improve health outcomes such as birth weight and improve nutritional intake in child recipients, including a potential reduction of dietary negatives like added sugar. Research overall suggests that food assistance increases general health status in children. A 2004 study in pediatrics reported that eligible infants receiving WIC assistance were less likely to be underweight and shorter when compared to their eligible counterparts who were not receiving WIC. They were also perceived by their caregivers to have better health. Likewise, a 2003 study in the American Journal of Agricultural Economics reported that in households participating in WIC, children were 6.5% more likely to have an excellent health rating. Data published in the year 2000 even suggest a relationship between prenatal WIC and child temperament. A study published this year in Health Affairs examined the effects of SNAP benefit reduction or elimination and found that both were associated with higher food insecurity, poor caregiver and child health, and increased economic hardship. Food assistance may have an effect on academic performance as well. A 2006 study in the Journal of Nutrition found that SNAP participation between kindergarten and 3rd grade resulted in reading and mathematics improvement in girls. A study published last year in the American Educational Research Journal reported a specific relationship between test scores and the number of days since a SNAP deposit, with the lowest score seen 30 days after the last deposit. Turns out it's hard to do well in school when you're hungry. That's not all. Recent SNAP data suggest health and economic benefits that last into adulthood, benefiting children across their lifespan and benefiting society at large. As adults, individuals that received food stamps in childhood were more likely to have better metabolic health, and women were more likely to have better economic self-sufficiency. In other words, receiving food assistance in childhood may actually reduce dependence on social safety nets later in life. Unfortunately, proposed federal changes aim to tighten eligibility requirements for SNAP, a change that would translate to roughly 3 million Americans losing food stamps, according to the U.S. Department of Agriculture's own estimates. This would include over 2 million households with children. It could also result in schools losing community eligibility, a policy that helps high-poverty schools provide free breakfast and lunch when at least 40% of their students have been certified for free meals due to their participation in programs like SNAP. An interactive data visualization out recently from Mathematica breaks down the potential impact by state and household characteristics. When I click on Wisconsin, for example, I see an estimated 18% of SNAP households would lose benefits under the proposed changes. Of those households, 24% bring in earnings, 16% house children, 26% house elderly individuals, and 9% house individuals with disabilities. Specifically, the proposed changes would limit categorical eligibility for SNAP. Categorical eligibility refers to individuals who are eligible for SNAP benefits without a check of their income, assets, and other circumstances because they've qualified for other programs that already require those checks. Recent analyses from the Urban Institute bring data to this discussion. The proposed limitations would cut SNAP benefits to approximately 2 million people in working families, with about 1.3 million unable to pass the income test and about 724,000 unable to pass the asset test. This would increase food insecurity in these families and require them to make more trade-offs between food and other basic expenses, particularly in areas with higher costs of living. In addition, loss of eligibility could be harmful to work incentives by negatively offsetting a family's finances. For example, cutting SNAP benefits to families who marginally increase their incomes via increased hours or small pay raises would result in overall financial loss for that family because the value lost in benefits outweighs the value gained from increased work. Beyond this, it could discourage families from building savings and investments if the trade-off is being hungry or having hungry kids in the short term. Currently, states are able to independently expand categorical eligibility, something that would no longer be allowed under the new rule. The proposed rule would also implement stricter qualifications for participants to be considered categorically eligible. In addition, a recent change to public charge determinations makes it more difficult for legal immigrants to obtain green cards if they've been recipients of public benefits like SNAP. Even before this change was officially implemented, 1 in 7 adults in immigrant families reported not participating in a non-cash government benefit program out of fear for their immigration status. 1/3 of families experiencing food insecurity make too much money to qualify for food assistance. They're too rich to get help, but still too poor to ensure that they and their families get enough food. It's important to remember that 2/3 of SNAP benefits go to families with children, so a lot of kids may suffer directly from the proposed rule changes. For some children, losing SNAP benefits includes losing access to free lunches too, and as we discussed last week, food insecurity in children and adolescents is associated with things like poor health status and poor school performance. Given the evidence for negative health outcomes of food insecurity, and given the positive health and economic outcomes associated with food assistance programs, we should be looking at ways to reduce, not increase, barriers for food insecure families. Hey, did you enjoy the episode? You should watch our whole playlist on social determinants of health and how important they are to health in general. We'd also like to ask you to consider supporting the show at patreon.com/healthcaretriage, where you, like our research associate Joe Sevitz and our Surgeon Admiral Sam, can help make this show bigger and better.